are you doing? Nice to see you again. PRP is being introduced as a new cosmetic treatment. It was originally used for orthopedic purposes. So here in our office, we're using it for anti-aging, so fine lines and wrinkles, acne scarring, and stretch marks. So we're gonna take your before pictures, and then after that, I'm gonna put your numbing cream on and let you sit here for about 20 or 30 minutes.
I have some premature aging and some really deep acne scars that are a symptom from some other health problems. The impact is pretty substantial. I have been trying for almost a decade to get rid of some of my scars, and after a while, you start trying anything and everything to try to deal with it. It's difficult to go about your dating life and your business life when you're always trying to cover up imperfections. If I just didn't have so many of them, I think I would feel better about myself.
Everything's done in the office. We spin the blood in the centrifuge device in the room. It takes about 17 minutes to spin the blood, and then after that, the platelet rich plasma is ready to go.
Anne contacted me about the possibility that this procedure might work for me. Being the optimist, I signed up for it and I'm trying it out, and hopefully it does work.
So there's a device with little needles in it. The needles pulsate and they go into the skin, or it's rolled onto the skin. It creates little channels, so it's actually breaking the skin. The blood with the platelets is able to penetrate deeper, and that is going to promote healing. It's going to stimulate collagen, help to get the skin to oxygenate better, help the skin to look more dewy and more youthful.
First and foremost, it looks far worse than what it is. I think visually it's just jarring. The needling, it's just such a small sensation for the most part.
Because there is the piercing of the skin with the microneedling, there is little pinpoint areas of bleeding. So the person is a little bit pink, a little swollen with little tiny pinpoint scabs. That typically goes away within 1 to 2 days.
Anne is, like me, an optimist. She has been rallying behind me and dedicated to trying to find something that works for me. Out of all the doctors, nurses, and PAs that I've worked with and had procedures done with, Anne is my favorite. She is my hope. She takes really good care of me. She makes me feel comfortable. She makes sure I'm safe. She talks me through the procedure so I know what to expect, and she follows up. She follows up like no one else ever does. She makes me feel like she genuinely cares.